what are the causes of knee pain?
Yeah, knee pain is a multifactorial thing. There are many causes. Everyone knows that there is osteoarthritis, degenerative disease, which is an aging process,
Yes.
or post-injury, because injury-prone joints will be having arthritis at an early age. So arthritis is one of the common cause. Everyone has some pain. Everyone thinks that it's because of arthritis. In young people, if they have muscle weakness, it is also called as chondromalacia patella, which is mostly seen in post-menopausal women. Obesity is another cause where most of the load is transferred to the knee joints. If there is a problem in the spine, there will be a referred pain to the knee.
When you refer a patient for MRI and when the patient should go for a CT scan?
Yeah, bone, usually we take CT scans. For the soft tissue like the muscles, the ligaments, the synovium, the cartilage, these are all best seen with MRI. He can't walk, he can't run, he can't go to the outstations.
Sir, on your 70 years of experience, on your 70 years of practice, mostly men are coming for the knee pain mostly, or women are coming?
When compared to men and women, knee pain is more common in women. Women. Because post-menopausal women have estrogen deficiency that causes chondromalacia patella, which is more common. It also causes knee muscle weakness, particularly quadriceps muscle weakness. So once they have this knee pain problem because of chondromalacia patella, or sometimes there will be maltracking. Maltracking is easy gliding of the patella will not be there. It will be moving this way and that way, out or in. So because of that, the knee pain increases. So in those kind of things, we first diagnose what is the most common cause of the knee pain. Then depending upon that, we suggest them to wear a proper footwear. If needed, we will use orthotics like patellar stabilizing knee braces, or sometimes if they have severe osteoarthritis, we suggest them OA knee braces, and these all are to offload the knee joint. And my suggestion to prevent knee problems for everyone is exercise regularly, at least 3 to 4 times a week, and then maintain a very good healthy body weight. I mean to say healthy body weight. And eat a very good antioxidant rich food. So these antioxidants are taken more and more to prevent the cartilage damages or micro injuries of daily problems. So I also advise to prevent injuries to the extent possible. So some people are injury prone. They should train in such a way that the injury should not occur in a frequent regular intervals, because once an injury occurs, it doesn't have time to heal, and then again re-injury occurs. That becomes a major problem. So using a proper shoe or footwear, maintaining a proper healthy body weight, eating good antioxidant rich food, and then regularly exercising all muscles and joints of the body.
How does age and activity level impact on knee pain?
Yes, age and the activity levels of an individual will definitely impact on the knee function. Suppose children have obesity, will have knee pains. Because of obesity, they have less activity, and because of that, knee pains will come. When age is increasing, the activity levels decrease because of the lack in the bulk of the muscles. When muscles become weakened, the activity levels will come down. Once the activity levels will come down, the function of the knee also will come down because of less usage of that joint. So knee joints are more commonly rested in aging population, and that causes muscle weakness, and that causes repetitive micro fractures or micro cartilage injuries, and that causes degeneration. So as age is progressing, definitely we need to keep our joints healthy by doing proper exercises and doing regular activities like walking, climbing, trekking, and this keeps our mind and body and soul very healthy.
For the age of 60 or more than 60 to 70 or 80 years patient, what are the exercises they should do?
Age is a number. Physiological age and chronological age many times differ. A 90-year-old can swim.
Yes.
A 60-year-old becomes sedentary. That all depends upon their activity levels and their mindset.
Mhm.
So, whatever the age may be, they can do minimal exercises like walking. If they can cycle, they can cycle. If they can swim, they can swim. So, whatever you do, the basic regular exercises should be done. So, these will keep the muscles in a perfect tone, and they will keep the joints aligned, and they will have good joint health.
Thank you, sir. But we have discussed a lot of things about how we will treat knee pain without surgeries.
Yes.
Could you tell something about what are the surgical options available and we can go for surgeries if we are suffering with any kind of knee pain? Those conditions, surgeries mandatory or needed?
Yeah, we have tried all the conservative methods.
Yes.
Suppose in injured knee, the ligaments are injured and there is an instability. We tried all the conservative options, but still the pain is not gone. Apart from that, instability is still going on. Then we have keyhole surgeries for ligament reconstructions. We have ligament reconstruction surgeries for kneecap maltracking. And in degenerative arthritis, where the deformities happen and the alignment has been changed, and people are unable to do their daily activities like pujas and collecting small things, going for nature calls, they are unable to do their daily activities, then that is the time we need to decide for joint replacements.
Okay.
Because joint replacement will help you in two ways. One, correcting your alignment, and at the same time, the degenerated joint has been replaced by the artificial joint, which gives a very good joint range of movements. The alignment will be corrected, and they can do their daily activities. They can even drive the car, they can swim, they can walk, they can do a brisk walking. So, these all things were done in severe degenerative diseases and in knee pains which are not treatable by conservative options. So, lot n number of surgeries were there, but all surgeries are not needed for every patient. So, surgery is always customizable. When we treat a patient, sometimes knee pains will be because of malalignment of the knee joint. In those kind of patients, we will correct the alignment.
Okay.
There are some surgeries called high tibial osteotomies. These osteotomies will correct the deformity, and then that gives a good alignment and function for the knee. So, when you have a knee pain which is not treatable by conservative options like non surgical options, then your physician or your orthopedic surgeon will suggest you preserving surgeries or joint replacing surgeries or joint reconstructive surgeries. So, have complete awareness of what's the problem is, what are the options non surgically we have. If it fails, then go for surgical options. And nowadays, we have a lot of technology. Whatever technology we have,
Yes.
we need to customize to that patient and undergo the surgery to get the best possible outcome.
Means final thing is that it cannot be treated with a non-surgical way. Then we can go for only surgical is the
Surgery.
only option.
Yeah,
So we can go
yeah.
for.
Because you need to increase the quality of your life.
Yes. Yes.
You can't keep on sitting just like that idle, thinking that I am done, I have no other option, I tried everything. But in this kind of new era, we have all the armamentarium from pills to surgery.
Yes.
Where you fit in, we don't know. We start with the physical therapy with mild analgesics to relieve your pain, do regular exercises. If it is cured, then it is fine. If it doesn't, then you go to the next cycle.
Yes.
Then surgical options will come. For surgical options, we have different set of modalities. Choose the best one, talk to your physician, and then go ahead.
So nowadays, arthritis is very common. What is the difference between osteoarthritis and rheumatoid arthritis?
Yeah, a very good question. Rheumatoid arthritis is an inflammatory disorder in which our own immune cells will target our own joint.
Oh.
And then this joint is deranged. The joint is degenerated because of the immune system derangement.
Okay.
And the joint gets deranged in such a way that the bone becomes very weak, that is osteoporotic.
Okay.
And the ligaments become very lax and the joint becomes degenerated. So deformities will be more in rheumatoid arthritis. Either the deformity may be outwards, that is valgus of the knee, or inwards, the varus of the knee, with excessive synovial tissue proliferation. That
Okay.
means inside we get lubrication. That cells will increase in order to reparative process. It increases and increases in such a way that itself causes more pain.
Okay.
Coming to degenerative osteoarthritis, as I told you before, the microfractures in the cartilage degenerate, again reparative process starts, again degenerates, again reparative process starts. This goes on for a period and it stays to that joint only. Coming to the rheumatoid arthritis, it affects all the small joints of the hand and the large joints of our body.
Okay.
Most commonly, hand joints are mostly
More
involved. Deformities will be there, and knee joints will be involved, hip joints will be involved, neck will be involved. So, rheumatoid arthritis is a generalized problem, where a degenerative osteoarthritis will be pertained to either the knee or the hip.
Okay.
It is like a overuse or because of the injury or because of the cartilage problems.
Yes.
So, rheumatoid arthritis, we need to use multiple modalities to treat it, to stop the ongoing inflammation and to correct the immunity and keep it in the right track so that the other joints will be prevented from damage.
Yes.
So, osteoarthritis will be particularly towards a large joint, either in the knee or in the hip. There will be there in the hands also, but that will not progress rapidly. Degenerative disease will be seen in elderly people.
Yes.
Rheumatoid is in elderly or at any age. So other arthritis like gouty arthritis, where uric acid will increase because of excessive intake of protein foods or alcohol. So we need to see the problem. Sometimes the kidney doesn't excrete the uric acid much, so kidney protective drugs should be used. Sometimes there will be other inflammatory disorders which are like SLE, like psoriatic arthritis or bowel diseases, chronic irritable bowels. So those kind of things, or reactive arthritis. There are many kind of arthritis. So depending upon which kind of arthritis, we need to go ahead and treat it as a whole.
Rheumatoid arthritis more dangerous than osteoarthritis.
Yes, because it affects all the joints. Rheumatoid arthritis will cause more damage than osteoarthritis.
So now we have discussed so many things about knee pain. Just sir, I'll ask few questions about myths. You tell me the fact, whether it's myth or fact.
Yes.
Stop physical activity. If a person is suffering with knee pain, he or she should stop physical activity.
No, decreasing the physical activity when you have knee pain is a myth actually.
Okay.
See, if there is an injury, usually we take rest for a brief period of time, whatever the healing time requires.
Okay.
But having knee pain or osteoarthritis restricting our physical activity is a myth. The fact is, you should exercise your knee joint so that the muscles will never become weak. So you can do physical therapy, strengthen your muscles, and then these in turn will increase the joint health. Unless you mobilize your joints, the health of the joint will never improve. Improvement of the knee movements will increase the health of the joint, whichever joint it is. Particularly knee joints should have a very good range of motions and good physical activity.
Yes.
So sitting idle, sitting sedentary will cause and increase knee problems.
Yes. Knee pain is only associated with knee problems.
This is a myth actually.
Okay.
Most of the problems may be caused by the ligaments or cartilage degeneration, or particularly the problems related to the knee. But it is knee is the only cause of knee pain is a myth. Sometimes the spinal problems may cause knee pain, that is referred pain. Sometimes the hip problems can be referred to the knee, and you can get a knee pain. Sometimes because of the malalignment of the foot or the ankle, because of this malalignment, you may get knee pain. So knee pain is usually the local problem, but we also should remember that other referred pains also will radiate to the knee, and they are also the cause of the knee pain.
Yes. Knee pain only occurs in the older people.
It is a myth actually. Knee pain can occur at any age. See, we have discussed many times that knee pain will occur in postmenopausal women, osteoporosis, rheumatoid arthritis in the early, in children. So knee pain can occur in any age. Only knee pains will be there only for older people. For younger people, knee pains should not come.
Okay.
That is a myth. Knee pain can occur at any age, depending upon either injury or malalignment or any cartilage degeneration. Obesity, overuse,
Yes.
stress,
Yes.
everything causes knee
Yes.
pain.
Prolonged medication is the only options of knee pain treatment.
It is a myth. Prolonged medication, like in diabetes or any thyroid problems like that, knee pain should not be cured with prolonged medications. Like taking mild analgesics is okay, but if you use these painkillers for a longer period, neglecting your cause of the knee pain and not addressing the actual problem, you will get the other side effects like the kidneys may get damaged.
Yes.
You can develop a peptic ulcers. You can have chronic problems which cannot be curable. So prolonged medication is not advisable. You need to consult your orthopedic surgeon, ask him until which duration I can take these medications, have a regular follow-up. Are there any other good pain relievers? And taking drugs over the counter is also a dangerous thing, because the pharmacist will give whatever you ask, but you need to decide whether you need to take it for a prolonged time or for a brief period. Taking for a brief period is not a problem, but what you are taking, do you have any idea about the side effects which the prolonged medication is causing? If you are not aware of it, it's not good.
Last one, steroid injections for taking for long period of time will permanently cure knee pain.
You mean to say that injections, steroid injections to the knee,
Yes,
will permanently cure the knee pain? So steroid injections for the knee were being used over a long period of time. Inflammatory disorders like rheumatoid arthritis or excessive synovial tissue formation, these kind of things, steroid injections will definitely decrease the pain, but prolonged usage of these injections may cause infections in the knee. They are temporary actually. You should not keep on taking multiple injections or for a brief period to get your pain decreased. You can take few injections, but that too prescribed and done by a trained orthopedic surgeon, so or a physician. So I do not suggest multiple steroid injections, and I do not suggest them for a prolonged time. They are only for a brief period, and that will be decided by the treating physician.
Thank you, sir. Today we have come to know so many things about knee pain, and we have discussed a lot regarding, apart from knee pain also we have discussed so many things. Thank you, sir. Thank you for joining.
Thank
our
you so
podcast.
much, Viswaranjan, for inviting me here to discuss about certain things. We had a wonderful time, and hope I have cleared many doubts regarding the general things about knee pain and options for decreasing the knee pain, and surgical and non-surgical options, whatever we do to keep the patient happy, to get his knee pain relieved. Thank you so much.
Thank you, sir.
Thank you.